You're watching Talk with Audrey. Welcome back. A recent national survey showed that despite progress, adults living with type 1 diabetes, or T1D, still struggle with the impact that the disease has on their lives. And more than 70% of endocrinologists and adults with T1D say that recent advancements give them hope for the future. My guest today is Dr. George Grunburger with the Grunburger Diabetes Institute and the immediate past president of the American Association of Clinical Endocrinologists. Welcome, Dr. Grunburger.
Thank you, Audrey, for having me. Thank you.
What is type 1 diabetes?
Well, type 1 diabetes is one of the major types of diabetes. Again, diabetes is a disease in which patients either don't make any insulin, just like type 1, or they make some insulin which doesn't work properly. It's type 2 diabetes. I mean, the disease is characterized by having high blood sugars, which eventually lead to the complication of the disease. But T1D specifically requires patients to take insulin for the rest of their lives. And this is where the challenge, of course, lies, to make sure that with that management, the blood sugar stays under control.
And insulin helps to maintain that delicate blood sugar balance in the body?
That is correct. And patients need to take insulin, but they have to take the right amount, which means they have to keep monitoring the blood sugar levels all the time. And this is where the struggle comes in, and the stress. And a survey which was conducted by the American Association of Clinical Endocrinologists in collaboration with Lexicon and Sanofi, was trying to survey the unmet needs of those patients who have to struggle every day with T1D. So as you said, while most endocrinologists and patients are hopeful for eventual cure, and people are excited about all the progress being made in managing the disease, they also uncovered that about 88% of adults with type 1 diabetes said that the daily struggle to maintain the delicate balance is imposing the challenges on how they conduct their ordinary lives.
So it's an ongoing maintenance problem.
Absolutely.
Well, then that also means that type 1 diabetes patients are constantly monitoring their insulin levels to be sure they're within range.
That is correct. And again, those challenges, as I said, bring the stress. And again, the survey uncovered the fact that many patients avoid certain social situations because of sort of worrying about that delicate balance, as far as eating out, exercising, socializing, and the things which other people take for granted.
What other aspects were explored in the survey?
Well, again, it explored the attitudes about both the advances and the challenges both the patients and their physicians have. And again, it uncovered the hope for the cure. It uncovered the enthusiastic, reception of the advances being made. But the third major point was it uncovered how many challenges still remain and the struggle the patients face in their daily lives.
Let's talk about the latest advances and what scientists and doctors hope to do to help make life better for people with type 1 diabetes.
Well, again, that's the key question. So I think the major advances which were made, there are new types of insulin available, which make it a little bit more convenient for patients to inject the insulin. There are advances being made in automating actual insulin delivery with so-called artificial pancreas. And there are advances being made in transplants of both pancreas and also the cells which make insulin, so the pancreatic islet cell transplants. So those things are exciting, results obviously of decades of research, and they give people hope that eventually it's going to be easier to manage the disease, but still, the major hope is for a cure, and it's not here yet. So in the meantime, we have to figure out how to best manage with what we have. And again, I think the conversation between the patients and the physicians is very important because the physicians need to hear from patients. Physicians obviously like to educate the patients, but in turn, they need to know what the patients actually would like to be sort of addressed in their management.
And when it comes to managing type 1 diabetes, is there one thing that someone with type 1 diabetes could do to contribute to their overall health?
One thing, of course, is to make sure that they adhere to the prescriptions which they agreed with their physicians. The other thing, the major advance, which makes it easier to manage, are the new types of continuous glucose monitoring. Because until now, the patients have to actually perform multiple finger sticks to check their blood sugar levels. Now, there are devices which allow continuous monitoring of sugars without the need for finger sticks. So that will give them a better insight of what's going on daily with their blood sugar levels, and hopefully again make it easier to manage that situation.
Are there some comorbidities that are also involved that make managing and monitoring even more difficult if you have T1D?
Oh, absolutely, because, remember, it's a very delicate balance. You alluded to it before. If the blood sugar control is not good, if your sugar levels are too high, that means there's not enough insulin working. These patients can get complications, whether it's the kidney disease, heart disease, going blind, potentially losing their limbs. On the other hand, if they administer too much insulin and the sugar goes too low, they can obviously go eventually into coma, lose consciousness. So this is literally a daily struggle to make sure that sugar controls are just right. They're not too high, not too low.
And if you have type 1 diabetes, what's the one question that you should ask your doctor if you're struggling with the impact that the disease is having on your life?
Well, the most important thing is how do I best control the blood sugar so it stays just right? That is, what is the right amount of insulin, type of insulin I need, and how do I monitor those sugar levels day and night?
And as always, be sure to speak with your doctor about your specific health issue and treatment options. Where can we go to find some more information?
Well, they can go for more information. There's a website on gobeyondinsulinalone.t1d.com.
My guest has been Dr. George Grunburger with the Grunburger Diabetes Institute and the past president of the American Association of Clinical Endocrinologists, and we've been talking about managing type 1 diabetes. Thank you so much for joining me.
Oh, my pleasure. Thank you for having me.
I'll be right back after the break.